You know the pain that comes when you fail interview, especially when you got all the questions and one one failed you. So the interview she went for, according to her, she said she felt she got all the questions, but one failed her. What was that one? They asked her, as a healthcare assistant, at some point in time, you may need to act as a chaperone. What do you think are your duties? How would you handle it? What are your responsibilities? A kind of, if you're asked to act as a chaperone, or if you're asked to become a chaperone, to be a chaperone during a procedure, what would you do? What are your responsibilities? That was how she put it to me. And to be honest, if I happens to be this lady, I will go off balance. Because it is, the question is rare. But you never can tell. Maybe this is another thing they are adding. I understand that healthcare assistants now, they are increasing their task. So if you are applying for the role of healthcare assistant, please listen. I had to go back to ask what is chaperone. But before then, I remembered when I was pregnant, I was not comfortable for a male doctor to attend to me. So always when a doctor is coming, if he happens to be a male healthcare assistant, a female will come with him. Do you get? So I now found out that healthcare assistant coming with the doctor is acting as a chaperone. I don't know. Is it chaperone or chaperone? I don't So what does it mean? Acting as a chaperone is just like a third party. Whenever the doctor, midwife, or nurse, whenever they want to carry out a procedure on a patient, sometimes a healthcare assistant acting as a chaperone, or who is the chaperone, will be there to witness what is happening. Okay, so your duty there is to make sure that the procedures are going on fine, is to communicate. Somebody, remember, when you are pregnant, they want to give you, what's that? This is anesthesia or so, yeah. And somebody is talking with you, gisting, asking you questions, trying to make you comfortable. I think they are the chaperone. Yeah, so what are your duties? Your duties there is to ensure the person's privacy. If there is they need to close curtain, and so that nobody will see, you have to close the curtain, communicate properly to the person what is going on. If the person is feeling like, oh, I'm not comfortable because it's the opposite gender attending to me, you are there. At least you are the same gender. So this is what chaperoning is all about. Okay, that is what it's all about. So putting it in interview mode now, if they ask you what you understand by that and what you think your duties are, I understand by that is that to be a chaperone is like a third party, a witness who is there to ensure that the patient's privacy is being maintained and respected, to make the patient comfortable, to make sure that I communicate very well with the patient just in case they need anything, to make sure that if for any reason somebody comes out tomorrow to say, during this procedure, this doctor did this to me or did that to me, they tried to take advantage of me or not, you are there as a witness, as a third party. You will come out to say, no, I was there. You understand now? So I hope this gives you an idea of what that means. I was so surprised to hear this one, chaperoning. So that is what it means.